Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. West 7 criteria, and this is for grading the mental status. So West 7 criteria, there are around 4 grades. Okay, so let's look at the first grade. First grade means there's a trivial lack of awareness. There's lack of the awareness. So trivial lack of awareness, and then there is euphoria as well as there is euphoria. There is euphoria as well as there is the anxiety. So there is euphoria as well as presence of anxiety. Next is there is a shortened attention span. So there is short attention. The shortened attention span. So the short attention span, there's impaired performance. There impairment of performance. So there's impair of the performance of addition and subtraction. So impaired performance of addition as well as the subtraction. So this was about the grade 1. Now let's look at what is the grade 2 about. So when you look at grade 2 is nothing but there is presence of lethargy. So there is presence of lethargy as well as there is presence of the apathy. So lethargy as well as apathy. So there is a minimal disorientation for the time and place. There is minimal disorientation. There is minimal disorientation, and this minimal disorientation is for the time and place. So minimal disorientation is for the time and place. And there is subtle personality change. There is a subtle personality change. Subtle personality change. And there is an inappropriate behavior with easily detectable flapping tremors. And there is presence of inappropriate behaviors. And there is also detectable flapping tremors. There is presence of flapping tremors which are seen. Now we move on to the grade 3. So what is very special about grade 3? So grade 3 is G3. So here there is presence of somnolence to the semi-stupor. So there is presence of somnolence. So the somnolence or the semi-stupor. So there is semi-stupor. But responsible to the verbal stimuli. So it is responsible to the verbal stimuli. So it's responsible to the verbal stimuli. Then it also causes a confusion. Responsible to the verbal stimuli causes confusion as well as the gross disorientation. So let's compare grade 2 and grade 3. Grade 2 there is lethargy, apathy. There is minimal disorientation for the time and place. There is subtle personality change. There is inappropriate behavior with easily detectable flapping tremors. Now when you saw the grade 3, there is a somnolence or the semi-stupor, but it is responsible for the verbal stimuli, confusion and the gross disorientation. Then let's look at G4. G4 means there is presence of the coma. This is G4. To learn and grow daily like this, please do subscribe.